Hello friends, I am Dr. Rajat Malot, Director Malot Hospital, Jaipur. Today we are going to discuss one of the very common problem in children, that is called as in-toeing or W-shaped sitting in children. Now this is a very common condition. Almost 2 children out of 10 can present to our OPD with this condition. Now the main thing is that parents are not aware about it, and we should know what are the basic reasons for in-toeing, and do we really need to worry for this in-toeing in a very small children. Friends, parents usually complain that the child falls frequently, and whenever the child walks he keeps his feet inside or turn inside, and the main reason they come to us is with a problem of the foot. When we examine these children, actually the problem is not at the feet level, it is right at the hip joint. So because of the hip version problem, the child tends to walk with the feet touching each other, and that's the reason the child frequently falls down as they hit as the feet hit each other. And because of this, the parents come to us with a problem that his feet has some problems and they are bending inside. So the main reasons for in-toeing is that there is an excessive femoral anteversion, which means the head of the femur is excessively anteriorly verted on the shaft of the femur, and as a result of which, whenever the child walks he has to move his limb inside, and because of this his or her feet start touching each other, and that's how the in-toeing occurs. Now what are the complaints of in-toeing? The child will walk most of the time with the feet turns inside, and the second most common symptom is that whenever the child sits, they will sit in a W-shaped position, which means that they will flex the hip internally, or they will rotate the hip internally and then bend the knees, and the legs will be on the outer side. So this is called as a W-shaped position, and this is the very common condition the parents complain. Now what are the main side effects if we don't treat them? See, in-toeing is a very common problem up to age 5 years, and most of them it resolves as the child grows, and by age of 8 to 9 years usually almost 90% of these children gets corrected. But there are certain children who are not corrected, and we'll talk on about those children later on. But what are the other things that you can do to make it more correctable at earlier age? So there are 4 or 5 things which parents can do, and that will help to improve this in-toeing. One and very important thing is that don't ask the child or encourage your child to sit cross-leg. It means that ask the child to sit with the knee folded, and this is called as cross-leg sitting. And the second thing is that ask the child to avoid W-shaped sitting. Don't abuse or don't repeatedly hurt the child. Just ask them to follow the cross-leg sitting and avoid W-shaped sitting. Thirdly, ask the child to walk a duck walk. If the child is reasonably of a good age, you can ask the child to walk on the feet pointing outwards, and this is called duck walk, and it's a very effective exercises. Then child can do a butterfly exercise where he can touch feet, and then ask the child to touch his knee on the outward side, and this is a very good exercise for in-toeing. Fourthly, a child can participate either in karate or a taekwondo classes where the postures are mostly on the outward side, and it really helps in correcting the in-toeing. Fourthly, there are certain braces which a child can wear in the night time, and these are called as abduction braces. And if the child can cooperate, and if they can wear this orthosis at the night time, it can help in correcting in-toeing. Normally this in-toeing corrects by 9 years of age. In case if there is a problem in some children and it doesn't get corrected, what are the side effects? Basically, it doesn't have any long-term side effect in terms of hip damage or any kind of other injuries. The childs are pretty much normal till the late ages. It's mainly a cosmetic deformity, and the always child will keep on walking in a in-toeing position, which is called as pigeon-toe walking, and this looks very awkward. So the main reason of treating this problem is a cosmetic problem, and after the age of 10 to 12 years we usually do a surgical correction of this in-toeing, and the surgical which we do is called as osteotomy, where we break the bone and then rotate it outwards and fix it with a plate or a nail, and the bone usually heals in a 1 to 2 months, and then the child can walk with a normal gait. So this is not a frequently done surgery, and most of the children, they get recovered spontaneously. However, in some cases we need to do this surgery, and the main reason of doing this surgery is purely cosmetics. At last, I would like to summarize that if your child walks with a in-toeing gait or a W, if he sits W-shaped position, then it could be a reason of excessive femoral anteversion in the hip. Ask the child not to sit W shape and encourage them to sit cross leg sitting. Ask them to do a duck walk, butterfly exercises, and if they can join karate or taekwondo classes, that will be good. And in case if it doesn't respond after 9 years, then we can perform surgery at any age, and the surgery is called as subtrochanteric osteotomy, and it has a very good results, and child can be corrected and his cosmesis can be improved a lot. With this, we end this talk, and in case you have any doubts, you can contact me. I am Dr. Rajat Malot, Director, Malot Hospital, Jaipur. We have treated many children of in-toeing successfully over the past years, and you can contact us. Thank you. Thanks a lot.